Alright then, the next nerve we'll talk about is the oculomotor nerve or cranial nerve 3. Now, this nerve is actually fairly long and complicated, so we'll talk about it in multiple lectures rather than one. One lecture will describe the basic anatomy, the other one will cover some important reflexes, and another lecture will basically describe the various lesions associated with this nerve and what can happen. So, as its name suggests, this nerve is involved with the movement of the eyeball. Oculo means eye, and motor means movement. Apart from this movement of the eyeball by controlling the eyeball muscles or the recti, this nerve also has a parasympathetic supply associated with it, and this parasympathetic supply is directed towards the pupil of the eye, and this nerve is involved with the constriction of the pupil rather than dilation. So this is the nerve which is involved with the two functions. Basically, one is the movement of the eye by controlling the eyeball muscles and controlling the size of the pupil when you're basically in a light reflex, for instance. So this is one of the two nerves which originate from the midbrain, and here's the midbrain. This is a very crude representation of the midbrain, and these are the two nuclei. This is the motor nucleus of the oculomotor nerve. This nucleus, this circular one, is basically what controls the movement of the eyeball. And which muscles does it supply? Remember that the muscles supplied by the oculomotor nerve are all muscles of the eyeball apart from superior oblique and lateral rectus. So it basically supplies the inferior rectus, the superior rectus, and the medial rectus. This other triangular nucleus, the parasympathetic nucleus of the oculomotor nerve, also known as the Edinger-Westphal nucleus, and this ends up on something called the ciliary ganglion, which then gives rise to something called the short ciliary nerve, which ends up on the pupil, and this is what controls the pupillary size. So here's a short description of the oculomotor nerve.